Good afternoon, everyone. I've got a spoiler alert. I haven't got anything as cool as you saw from Professor Hare, just to be blunt. I think that's just extraordinary, and it's incredibly difficult to follow something as inspirational as what you just watched today. But I'm going to try my best just to describe what we in industry are trying to do around the concept of digital health at both the population level as well as an individual level. Just a bit about myself. I was trained in medicine during the analog age. Okay, I was very lucky to have lived through the time when the Human Genome Project actually reported out. And if I was retraining myself as a modern doctor today, I would probably spend a few years doing computational science and computational biology, because I think the world is going to fundamentally change. I'm a huge believer, and I've seen a living example on stage today of how digital health and technology is going to change fundamentally how we look at healthcare at the individual level as well as the population level. So before I just talk about this is the obvious. I think you've seen it on stage, but I just wanted to show this for fun, that it took 75 years for the telephone to reach 100 million lives. It took 4 years for the iPhone in 2011 to get into the hands of 100 million people. But it took Pokemon Go 3 weeks to get to 100 million users. Now, we can all argue about the societal use and values of Pokemon Go, but I think we all agree that if 100 million people could be accessed that quickly with a technology, with a tool that could actually help healthcare, how profound would that be? And I think we're all living in this disruptive age. We experience it every day. And I do believe that the digital health revolution is also part of the same journey that's happening in society. So what do I mean by digital health? I think you saw the living example of the convergence of both the biological and engineering as well as the physical science. And you heard today also from the first speaker about new material science that also can be used fundamentally to change the way that human health is going to be looked at. So I'm going to try and give you a talk about why digital health is so important for us as a life science industry. There are 5 converging factors that are taking place right now that are actually driving this inexorable rise in digital health. The first one is that we all know that the costs of healthcare is trillions and trillions in every government is struggling to keep up with the pace of the burden of chronic healthcare delivery. And so everyone's looking for better, cheaper, more effective ways to deliver higher value and higher and better outcomes for diseases, especially as longevity is actually creeping across the world and people are living longer, they're suffering from more chronic diseases, they're suffering from new diseases, and then we're now seeing the rise of cancers coming up in the late stage because of longevity and because of the advances in medicines before. So that's driving some of the need for look at new solutions. The second one, which is just obvious, is that drugs for many diseases are only part of the solution. So if you're lucky and you don't have a disease which has a monogenetic therapy, you'll get about a 50 to 70% response from the best therapeutics available. But we do know that technologies and tools can actually help address much of the residual burden. We can amplify the value of the drugs. We can amplify the outcomes. You can improve the adherence. You can address many of the emotional or behavioral issues that you need to also get the best of the outcomes. And we can understand the data that drives it. We also know that now there's the patient empowerment revolution. Most of the technology companies are actually targeting patients, giving them new sensors, new mobiles, new information that allows them to take more control of their lives and actually determine what they want to do. It's not quite biohacking, but the number of people now who are doing 23andMe and getting genetic samples and actually asking themselves, well, what does it mean for my health, is huge. And how do we use this information? How do patients know what best to do with this information? Even in the US, a patient is legally allowed to download all of the electronic health records, okay? And that has to be provided in a very narrow space of time. But what's the patient going to do with it? So a lot of the tech companies are now coming and say, let us help you to actually understand this information so you can now have informed choices and make it simple for you to digest your information. The third piece is physicians. Physicians today are getting more and more remunerated around how can I find better ways to actually improve the outcome of my patient. Can I use technologies to improve outcomes? Am I reimbursed to do that? And the answer is yes. In many cases, they are getting increasingly enabled to actually use technologies to actually improve patients. And we're now seeing receptivity, and I'll talk a bit more about this, for patients, for physicians who can actually prescribe apps to treat patients. And we're now at that era where we have digital therapeutics that physicians can prescribe to patients, and I'll talk a bit more about that in a minute. But we're also going to hear from the FDA, and the regulators are being incredibly supportive of accelerating this adoption of technologies, the use of big data, the use of artificial intelligence, and understanding and predicting diseases. And so the regulatory environment is changing fundamentally, and it's really the US is leading the way to allow a lot of these industries to now converge on how best do we take this and accelerate our ability to leverage technology for better outcomes. And then the last piece, which is the most fundamental, is the fact that technology itself is advancing inexorably. And we're finding new ways that we never could have dreamed or believed about how this can impact healthcare. So those 5 converging factors are just so profound that you're seeing now the inexorable rise of digital health. And this is disrupting healthcare everywhere, and it's particularly happening because it can disrupt healthcare in places in the world where it can actually equalize and democratize healthcare delivery, where healthcare or access to specialists or access to physicians is not that available. And actually technology is allowing it to reach out and actually get to people and get high quality healthcare across the world. And we are at a Gutenberg moment. When Gutenberg invented the printing press, there was a freedom of information. Now we're seeing the liberalization of healthcare, potentially through the use of technologies. So this is a complicated slide. I'm not going to go through it, but I just want to show you some of the things. And you witnessed them live on stage today about how some of the technologies, when blended with biology, blended with medicine, blended with a deep understanding of both physics and biological science, can actually fundamentally shift individual human behavior. And what we're also seeing now is other areas that you probably aren't that familiar with, the use of gamification in treating diseases. You know, the addictive power of games that we always criticize our children, I certainly do, for getting used to. But actually that same technology and the same mindset can be used to actually deliver therapeutics for cognitive behavioral therapies. And we're seeing that it's just the age that we're in today. We're also in the age of now telemedicine. Telemedicine, you know, in the US, we still have just about a dozen places which are fully embedded with telemedicine capabilities. But in China, the whole telemedicine hospitals treating hundreds of millions of people remotely, where there's literally a bank, looks like NASA space station, where people are consulted remotely through AI and chatbots. This is the first time in history that we have seen in 2017 a robot that's fully qualified, potentially, in most of the key disciplines in medicine. And it could be, potentially, the first non-human that's ever potentially licensed to practice medicine, okay? Using AI, a deep AI learning and deep technologies. And when you combine that with the genomic revolution, the ability to use these big data approaches to understand how to design molecules, to predict the diseases in a more sort of predictable manner, to actually understand pathways, to actually simulate the potential outcome of your trials, which have cost us hundreds of millions, to actually simulate diseases so you won't have to put patients through many of these programs. We have big trials that costs lots of money, but also we have to recruit patients to them. But imagine if you could simulate what the trial could look like. So we're now at that age, and I think we're seeing the first of the experiments that are being conducted with the regulators to make it work. So I think we really are at a critical time point. I also don't want to underestimate the role of wearables. I mean, we all wear devices today. I used to dream about a time when I could walk around and knew my blood pressure, knew my blood sugar all the time, and I could actually predict what's going to happen every time I actually did some exercise. We're getting there. We're getting to a point where blood pressure rings now can be used, or blood pressure devices can be worn, which measure your blood pressure throughout the day. So you're moving from not just having an observational time point where a physician makes a decision, but all of that data comes together in an integrated way, so you actually get decisions that close the gap to when you need them to actually be present. So just a word about AI. Again, a bit of fun. So I'm a chess player, and my soul got destroyed in 1998 when Big Blue defeated Kasparov. I think that everyone went, okay, yeah, it's great. But then it took 18 years before DeepMind developed AlphaGo that actually then beat the 7 out of 8 games with the Go champion. Now, many of you are technologists, you think that's, you know this already. But what I didn't know was that Go is 10 to the 100 times more complex than chess. And then it took 4 years for DeepMind to create something called AlphaStar. And AlphaStar, apparently, I'm not a gamer, but the gamers tell me that this is a very complicated game. It requires long-term strategy, has a lot of intuition built into it, has a lot of sort of emotional components to the game design. There's a lot of game theory that goes into this. But it's 10 to the 1685 times more complicated than Go. And actually, AlphaStar kind of mastered StarCraft 2. Now, I say this only because they also developed AlphaZero that taught itself how to beat Go and how to beat AlphaStar within weeks. So we're at a new age of AI. And I do believe that AI is fundamentally going to disrupt the way that we deliver healthcare, in the way that we can predict both molecules to be delivered, the individual patient responses, the ability to develop new digital biomarkers that actually will predict what we call the new digitome. This is the new omics today, the behaviorome, how your own behaviors help us to predict what's going to happen to you in disease and how we can actually then find solutions that will help to modify or prevent that. So I'm going to come back to what as an industry are we doing? Well, apps. We develop apps for just about everything. And we have apps for digital biomarkers. We see a whole industry coming up on helping us to actually identify, can we predict diseases earlier? Can we actually look at remissions, or can we predict relapses? And actually find ways to actually integrate those into our trials, into our medicines, and into our healthcare delivery. We're looking at drug companions. So can we wrap a technology around a drug to improve the outcomes of that drug? Almost building that precision patient interface, which actually gives us a personalized approach despite the more kind of amorphous, heterogeneous view of the drug, but we can make it more personal for the individuals. There are now ways that we're looking at standalone digital therapeutics, and I'll give you an example of that on the next slide. But we're now at this age where digital approaches can replace treatments, can actually also treat diseases that we never otherwise could have managed well before. And we're seeing the first of these big integrated platforms that can actually change behavior to prevent diseases such as type 2 diabetes, can actually manage cardiovascular health in a more chronic way. And it can deliver these remotely and cheaply. And that's the key. Can we disrupt healthcare so fundamentally that actually the overall well-being, either at a population level or at an individual level, is disrupted? And again, just a word to the FDA. I think the FDA has led the way. And they started a program which has allowed companies to experiment with new technologies, to actually do the co-designing together, to try and predict what the outcomes would look like, understand how the regulations would evolve, how does it impact things like data privacy? How does it impact how people feel? How would a doctor use it? What is the level of evidence you need? What's the level of science and scientific scrutiny you need to have around these to approve them? And we've seen now the first digital therapeutics approved in 2017. We've seen the first technology adjacent drugs, where there's a little chip on a tablet approved at the same time for it. And now there's a pipeline of these approaches with the FDA. So we're now at an age where physicians will be able to prescribe digital therapeutics, and patients can actually download an app on a prescription or a QR code and be treated remotely for certain diseases. So I think it is a great time to be in our industry, where we get a pipeline of new biologic drugs and a pipeline of digital drugs. But the ultimate for us when managing diseases is, how do we manage big populations, but at the same time individualize the care so that individuals get what they feel is an adequate response for them. And these integrated platforms where you can combine telehealth with mobile technologies, with custom-made sensors, with custom-made high-quality devices that allow you to pick up the specific disease parameters you want at home. Together with coaching, together with augmented intelligence-assisted coaching, physicians who have AI tools that will help them to actually converse and intervene at the right time for the patients. And to do that in the patient's home, in their natural setting, as opposed to having them come into hospital, and therefore reducing the cost of the infrastructures that we have today, would be a remarkable step forward. And we're seeing the first experiments today where major companies, and it's what I've shown you on stage, is a joint venture that we have with a company called Verily, that actually is created this type of ecosystem. And we're seeing incredible results for the patients at dramatically low cost. So I think that the time is now, and we're at that particular juncture in medicine, and I really believe this is a major disruptor. Just before I close, I think there are many, many issues we have to overcome. Issues of privacy. So the moment you start to get into this, patients have to be willing to actually engage at an individual level on their data. What do we do with that information? There's so much information that we can create. The behavioral realm requires patients to give us their data, allow us access to it with consent, to use it for their own good. We also have to watch out that, when you have artificial intelligence, are the machines being taught appropriately? Are the data sets appropriate? How do you avoid bias? How do you avoid adversarial attacks, which are so easy? Because when it happens in health, there's so much money available in healthcare that if someone perverts data to try and skew an insurance claim, how do you avoid that? So this raises a whole new spectrum of new issues for us. But I believe that as a society, if we really feel that we can actually deliver better healthcare for everyone at a much lower cost and improve just well-being for better life, then this is clearly a way forward, and we as an industry should be embracing it. So to conclude, to go back, Sanofi is a French company. I had to quote Victor Hugo. I really do believe that nothing can stop an idea whose time has come, and the time for digital health disrupting our industry completely and improving healthcare globally is here. So with that, I'd like to thank you for your time. Thank you.